So, hello students, and welcome back to the clinical anatomy case discussion series of upper limb. आज है series number 7. कैसे लग रहा है? I hope you have seen all the case discussion clinical anatomy series. सब देख लिया है. I'm sure you must be able to correlate what type of clinical questions are asked. ये पूरा playlist देख लो of the upper limb. वैसे ही बाकी के topics के भी हम करेंगे. हाँ. So just see the entire playlist, you'll get a complete idea. Okay, so आज का सवाल, have a look. A cyclist developed numbness in the palmar 1.5 digits and weakness of the interossei. बच्चों जब ये क्लिनिकल सवाल पढ़ते हो आप, the moment you come to this, something should click to your mind. बराबर है? Weakness of interossei. क्या लग रहा है? Weakness of interossei कौन है वो? Which is the nerve which supplies the interossei muscles of the hand. ये जितने भी palmar interossei है, which does adduction, and the dorsal interossei, which does abduction, who supplies? Ulnar nerve, right? Plus palmar 1.5 digits, ulnar aspect of 1.5 digits, who supplies this? Ulnar nerve. तो I know there's something to do with the ulnar nerve. मतलब ये सवाल ulnar nerve पे based है. Something is coming to my mind. ऐसे आपको analyze करना है before seeing the sub questions. Okay, so cyclists develop numbness, tingling in the palmar ulnar 1.5 digits and weakness of interossei. Dorsal ulnar hand sensation is preserved. मतलब dorsal aspect का sensation preserved है. खाली palmar aspect का sensation is gone. Palmar aspect and dorsal aspect ulnar hand sensation. पूरा dorsal aspect नहीं जाएगा, but partly will be gone. Partly जाएगा. So what do you say, बच्चों? Ulnar nerve. कुछ ulnar nerve के बारे में भी discuss about the ulnar nerve. Can anyone tell me ulnar nerve is a branch of which cord? Yes, medial cord. What is the root value of ulnar nerve? C7, C8, T1. C7 fibers come from lateral cord. C7, C8, T1. अब ulnar nerve in the forearm, I mean in the arm, lies behind the medial epicondyle. फिर ये forearm में आती है. Then it enters the hand. When it enters the hand, how does it enter the hand? Have a look at this. So ये टनल का नाम क्या है? What was this tunnel? याद है आपको? So ये ना carpal bones है. These are the carpal bones, and this is the medial and the lateral part. What is this tunnel known as? Carpal tunnel. अब this carpal tunnel on the medial aspect shows an extension. ये extension का नाम क्या है? What is this known as? This is the volar carpal ligament. That's a volar carpal ligament. And ये जो tunnel है, this is the volar carpal ligament. ये जो tunnel बन गया, what is that tunnel known as? The Guyon's tunnel, right? G-U-Y-O-N-S. Guyon's tunnel. So that's Guyon's tunnel. So what passes through the Guyon's tunnel? Medially है ulnar nerve and laterally is the ulnar artery, right? So how is the Guyon's tunnel formed? It's an extension of the flexor retinaculum that is known as volar carpal ligament. ये है flexor retinaculum, that's the volar carpal ligament. ये बन गया Guyon's tunnel. And who lies in the Guyon's tunnel? The ulnar nerve and ulnar artery. Perfect है? Now this ulnar nerve enters the hand. And divides into a deep branch and a superficial branch. And a deep branch. Fine. Now this deep branch supplies how many muscles? Deep branch is motor. बराबर है. Deep branch supplies how many muscles? Any guesses? The three muscles of hypothenar eminence. Abductor digiti minimi brevis, flexor digiti minimi brevis, opponens digiti minimi. बराबर है. Abductor digiti minimi brevis, flexor digiti minimi brevis, opponens digiti minimi. The third and the fourth lumbricals. 4 plus 4 interossei. मैं डायरेक्टली लिख रहा हूं. 4 dorsal and 4 palmar interossei. Adductor pollicis and the deep head of flexor pollicis brevis. So ulnar nerve supplies 15 muscles in the hand. बराबर है. The abductor digiti minimi brevis, flexor digiti minimi brevis, opponens digiti minimi, the third and the fourth lumbricals, 4 palmar, 4 dorsal interossei, adductor pollicis, and the deep head of flexor pollicis brevis. So these are the 15 muscles supplied by the deep branch of ulnar nerve. अब this superficial branch of ulnar nerve is sensory, बराबर है. This superficial branch supplies the skin on the palmar aspect of medial 1.5 fingers. Palmar aspect of medial 1.5 fingers and the dorsal aspect of 1.5 fingers except the proximal phalanx. Except the proximal phalanx. So this this ulnar nerve, just one moment. This ulnar nerve supplies the skin on. Okay, just one moment. This ulnar nerve supplies the skin on the palmar aspect of 1.5 fingers here and the dorsal aspect of 1.5 fingers except the proximal phalanges. Except the proximal phalanges. Fine. Now, can anyone tell me who supplies the skin over the hypothenar eminence? चलो और एक slide draw कर लेते हैं आपके लिए. I'll just draw one more slide for you. ये देखिए, this is the palmar aspect. ये ऐसे palmar aspect draw किया, thenar hypothenar eminence. Okay, and this is the dorsal aspect. Dorsal aspect. Fine. So, who supplies the skin? तो मैं ulnar nerve draw कर रहा हूँ यहाँ पे. I'll just make like this. This is the volar carpal ligament. This is the ulnar nerve. Ulnar nerve. Ulnar nerve enters the hand, then divides into a deep branch and a superficial branch. हाँ, ये superficial, ये deep branch हो गया. This superficial branch supplies the skin on the palmar aspect of 1.5 fingers. 1.5 fingers को supply करती है palmar aspect of 1.5 fingers and the dorsal aspect of 1.5 fingers except the proximal phalanges. This is the dorsal aspect. ये palmar aspect है, ये dorsal aspect है. तो 1.5 fingers skin on the palmar aspect is supplied by the superficial branch of ulnar nerve. Superficial branch of ulnar nerve. This is the deep branch and that's a superficial branch of ulnar nerve. ठीक है? The superficial branch supplies the skin on the palmar aspect of 1.5 fingers. The same superficial branch dorsal aspect पे जाती है, supplies the skin of 1.5 fingers except the proximal phalanges. Except the proximal phalanges. ठीक है? Now, this ulnar nerve in the forearm, ये forearm है. This ulnar nerve in the forearm gives a branch. What is this branch? This is the palmar cutaneous branch of ulnar nerve. This palmar cutaneous branch of ulnar nerve is given in the forearm. तो forearm में देती है, it goes above the flexor retinaculum. ये flexor retinaculum के ऊपर से जाती है and it supplies the skin of the hypothenar eminence. Skin of the hypothenar eminence plus this ulnar nerve gives one more branch. पीछे देते हैं ये, पीछे and this branch goes on the dorsal aspect. पीछे जाती है. What is this branch known as? Dorsal cutaneous branch. Dorsal cutaneous branch. Now this dorsal cutaneous branch supplies the skin on this 1.5 fingers and the dorsal. This is the dorsal cutaneous branch of ulnar nerve. Dorsal cutaneous branch of ulnar nerve. What is this branch? यह है superficial branch of ulnar nerve. Superficial branch of ulnar nerve. ठीक है? So ulnar nerve supplies the skin on the palmar aspect of 1.5 fingers and the dorsal aspect of 1.5 fingers except the proximal phalanges. The proximal phalanges of 1.5 fingers and the dorsum is supplied by the dorsal cutaneous branch of ulnar. Fine. The skin over the hypothenar eminence is supplied by the palmar cutaneous branch of ulnar. So, एक और slide draw करता हूँ आपके लिए. देखो, I'll draw the slide for you. So, ulnar nerve. हाँ, ऐसे दो branches बनाता हूँ in the hand and in the forearm. In the hand, it gives a superficial and a deep branch. Superficial and a deep branch. In the forearm gives palmar cutaneous branch and a dorsal cutaneous branch. Dorsal cutaneous branch. ठीक है? So now you tell me if the ulnar nerve is injured in the forearm. अगर forearm में injury होती है ulnar nerve की, so everything is gone, है ना? अगर forearm में injury होती है ulnar nerve की, here, if the ulnar nerve is injured in the forearm, तो सुपरफिशियल भी गया, डीप भी गया, पामा क्यूटेनियस भी गया, डॉर्सल क्यूटेनियस भी गया, एवरीथिंग इज गॉन, एवरीथिंग इज गॉन, ठीक है ना. सो एवरीथिंग इज गॉन. 15 मसल्स आर पैरालाइज्ड, 15 मसल पैरालाइज हो गया. देयर बी अ कंप्लीट सेंसरी लॉस, कंप्लीट सेंसरी लॉस हुआ. इफ द अल्ना नर्व इज इंजर्ड इन द हैंड, अगर हैंड में इंजरी होती है तो विच ब्रांचेस आर गॉन? सुपरफिशियल एंड डीप ब्रांचेस आर गॉन. Superficial and deep branches are involved. Agar ulnar nerve is injured in the hand, so 15 muscles will be paralyzed. Plus, ये जो yellow दिखाया है, that sensations will be lost. The one which is shaded in yellow, that sensations will be lost. Which sensations will be intact? The nerves which have been given in the forearm. जो forearm में nerves दिए, वो sensation intact होंगे. मतलब if the ulnar nerve is injured in the hand, the the hypothenar eminence intact होगा, skin plus this dorsal aspect, the skin is going to be intact. Is this clear to all of you? हाँ, so in short मैंने ulnar nerve describe किया. Ulnar nerve, how does it enter the hand? Through the Guyon's tunnel. Hand में enter करने के बाद it divides into a superficial and deep branch. In the forearm, the ulnar gives a palmar cutaneous branch जो ये hypothenar के skin को supply करेगा, and a dorsal cutaneous branch जो dorsal aspect के skin को supply करेगा. Perfect है? I hope this all things are clear. This is a brief review. Have a look at this. So, a cyclist developed numbness and tingling and the palmar aspect and interossei. मतलब ये कौन सी है? Superficial branch. ये कौन है? Deep branch. Deep branch. So superficial and deep branch is involved. मतलब where is the ulnar nerve injured? Plus dorsal aspect का sensation is preserved. मतलब where is the ulnar nerve injured? In the Guyon's tunnel. In the Guyon's tunnel. So diagnosis or lesion side क्या आएगा? Guyon's tunnel. Guyon's tunnel और the hand. Guyon's tunnel में इंजर होगी या फिर hand में इंजरी होगी? Hand में इंजरी. Why is the dorsal sensation spared? Because the branches are given in the forearm. Branches are given in the forearm. समझ में आ रहा है? Branches are given in the forearm. Whereas ulnar nerve की इंजरी कहाँ पे? Hand में. So that will be spared. What is a classic bedside sign may be positive for adductor pollicis? Adductor pollicis के लिए what is the test used? Book test. Book test करते हैं. So the person is not able to hold the book. अगर आप book दोगे हाथ में, the person is not able to hold the book. So that is the test. Book test for adductor pollicis. And name the canal. Boundaries of the canal. So which canal are we talking about? Guyon's tunnel. है ना? Guyon's tunnel के boundaries क्या है? Whose below flexor retinaculum and whose above the volar carpal ligament. मतलब ये flexor retinaculum है, and what's this? The volar carpal ligament. And what's this? The flexor retinaculum. Flexor retinaculum and the volar carpal ligament. So what is that? Guyon's tunnel. Fine students, I hope this is clear to all of you. So this is how you correlate. हाँ, ऐसे correlate करते हैं. So बच्चों, आपके लिए एक special MCQ only for you. Muscle supplied by ulnar nerve in the hand includes all except. Answer को comment box में MCQ को आंसर करिए. Answer this MCQ in the comment box. Ulnar nerve supplies all the following except. So student, this is the clinical anatomy series जिसमें हम case discussion करते हैं. So I hope by now you are able to understand all the cases of the upper limb. Something similar will be asked in the exam. Something similar. हाँ, case ऐसे ही देंगे कुछ, and सब questions होंगे. You are supposed to attempt it. And जो पूछा है वही लिखना है. Whatever is asked, that you have to write. Okay, that's how you get the marks. बच्चों, ठीक है? I hope everything is clear. ये playlist जरूर देख लेना. It will be very beneficial for you. Thank you so much from the entire team of Anatomy Unlimited for you. Thank you so much. Bye bye. And आगे की सीरीज देखते रहना. Okay, bye bye.